My name is Thomas Johnson. I was diagnosed with hypertension in October of 2013 and diabetes about 15 years ago. My initial reaction was like, well, my whole family, my mother was a diabetic. She took blood pressure medicine. My dad, he's a diabetic, you know. My son's mother, she's a diabetic. And to me, it was really a shock. Not really a shock, because I know they said along with diabetes, blood pressure and diabetes work together. And so like I said, I just want to jump on it early so I can just sort of like get rid of it. Because I'm not going to be taking all these pills all my life. Because I just recently been laid off of work, I said about 6 months, and then again, you know, exercising-wise, I'm not getting the proper exercise that I need, you know. I'm overweight, 8 pounds, and I just don't feel as though that, I'm not really worrying about it because I know I'm going to get rid of it. I'm not going to have that problem. I take my medication 3 times a day. I take a diabetes pills and a Metropro in the morning. And they just recently put me on a hypertension pill with a water pill. I take that I take it twice, one in the morning, one at lunch. And then at night, I take 4 pills, a diabetic pill, hypertension pill, Metropro, and he just recently put me on another one. And then at my last meal of the night, I take a diabetic shot. Stress plays a significant role for the simple fact that, you know, you got just your kids to where I only got one. I worry about my son, you know, how he doing in school, and you know, then you worrying about bills being paid and when you're gonna go back to work, is your unemployment gonna get cut off? You know, it's a lot plays into that role. I used to be in the street. I used to hang on the street corner. I used to be with the wrong crowd. I done been shot, I've been locked up, but thank God that all that's behind me now. Prayer helps everything. You know, and I'm active in church. And I just pray and ask the Lord, He knows what's best for me. You know, because I didn't make it this far along. And so that's what helped me with my stress. I think it's important that you watch what you eat. I think we can't eat, like they were saying in our first volunteer session, the food that our forefathers them ate. You know, all the soul food, the fried chicken, the hog mugs, the chitlins, the ham hocks, and you know, stuff like that. But I'm gonna eat some fried chicken once a week though. I'm gonna eat some chicken. Okay, exercise. I think you ought to, well, I think I gained this weight because I'm not working, and you being at home, you go look in the refrigerator, go from the refrigerator, look out the window, it's snowing outside, and saying to yourself, well, what I'm gonna do. But I think that if I was working, I'm very active, because see, I worked at Metro Airport. I did a lot of walking. Even though I drove the machines to clean the floors at the airport. You know, I was a floor technician, and riding that machine, you want to get it, but before we do the floor, we gotta, you know, walk half a concourse, if you've ever been to Metro Airport, you know, to dust it and get the cracks and stuff, and then you ride your machine. The recent volunteer that's from Cabrini Clinic with me, we experienced, well, I experienced, and he did too, because we was talking about it, that the doctor, he doesn't see the same doctor every week. It might be another one. But this particular doctor, you know, he looked at my chart and said, okay, your blood pressure high, I'm gonna change your medication. Okay, but he told me he was going to change it, but he didn't explain to me what it was. And then after the clinic didn't have the prescription, and then when I did get the prescription, and I believe I went to Kroger's to get it filled out, and the pharmacist told me then that what it was for, it was a water pill and a blood pressure pill. And my first impression is I never took a water pill before. And so the next time I went back to the clinic, I told the next doctor that I seen that he had changed my medicine, and that what was this pill. He explained to me what it was and the effect it would give me. The last meeting we had, the guy told me, that was another volunteer that was here, go to the clinic I go to, an older gentleman told me the reason you getting cramps in your legs is taking those pills. He said you should tell them change them, and so they changed them about a month and a half ago, and I've been doing fine. You know, that was one of those blood pressure medicines, Simvastatin, you know, and I'm like, dang, I'm getting these cramps, you know, because my mother, when she was living, she used to get cramps. I'm like, you know, I knew it was coming from the medicine, but I'm just saying to myself, you know, why am I getting these cramps? But ever since they changed them, I've been doing fine, no cramps. Black men don't go to the doctor, I believe, because they think that they can overcome any illness. It'll go away. That's what I used to say. Oh, I'm not going to worry, it'll go away. But that's not the case all the time, because see, the exterior could look good, but what about the interior? I tell the African American, if you have hypertension, or if you're a diabetic, or if you're AFib like myself, and which I had open heart surgery, is to go to the doctor. Take your medicine, stay in shape, eat healthy. That's what I would tell the African American.